Happy New Year. It's quite the pleasure to have you on another episode of the Medi-Camp Health Show. I am your host, Mumbi Mavuti, and today I'm here with Dr. Vincent, who is going to be talking to us about prostate cancer. Stay tuned. Don't leave even for a minute. We have a lot to learn together. Karibu sana, Daktari.
Asante sana.
Happy New Year.
Happy New Year to you and to all the viewers.
Thank you. It's a pleasure having you here.
Okay.
So kindly just take a minute, introduce yourself to our viewers.
Okay, good evening all. My name is, as stated, Dr. Vincent Mbuga. I'm a senior medical officer, currently medical officer in charge at Kiriaini Mission Hospital. Kiriaini Mission Hospital is a level 4 facility in Muranga County under the Catholic Diocese of Muranga.
Thank you so much. We are happy to have you. So we are going to be educating our viewers today about prostate cancer. So even before we talk about what is cancer of the prostate, what is prostate?
Okay, for prostate is a gland possessed in the male, just above the bladder. Its main role is production of seminal fluid. Seminal fluid is a fluid which is used to transport the semen. It forms the semen. Now you just transport the sperms during fertilization. That is the main role of the prostate gland. Yes.
So now what is the cancer of the prostate?
Now cancer of the prostate, now this is where we have changes in the cells becoming malignant. The cells now grow without limit. Basically now that is what is called the cancer of the prostate. The reproduction of the cells beyond control. There is a limit where the cells are supposed to grow, but once they start multiplying and growing without regulation and changes in the morphology, that is now the cancer of the prostate.
They are growing in the prostate.
Yes, in the prostate gland. They can grow in the prostate gland, and at times they can spread outside. They can go what we call metastasis, spread outside the gland. Yes.
Does it only predominantly affect the male?
Yes, because it's only the male who have the prostate gland. If you don't have a prostate gland, you cannot get a prostate cancer. So it's predominantly for the male. Yes.
So what are some of the risk factors for someone to develop prostate cancer, and is there an exact known cause?
There's no exact identifiable cause, but there are factors which are associated with development of prostate cancer. First, you have to be of the male gender. You have to possess the prostate gland, okay? So just sex, being male. Age, as you're advancing in age, cancer has been detected in people even at 40. The earliest mostly is really in the 5th decade of life, but fasting at the age of 40 up to 70, that is when most of the diagnoses are made. So just advancing age. You have other factors like genetics play a very important role. When you have a family history of prostate cancer, there are high chances of developing, especially in a first-degree relative. Maybe in a family, maybe your brother, father, your grandfather, anyone in the lineage, a male in your lineage, had a history of prostate cancer. You have high chances of development of prostate cancer. There are genes which are associated, the same genes associated with breast cancer. So in a family where there's history of breast cancer or prostate cancer, you have a high likelihood of developing prostate cancer. Other factors is smoking, alcohol use, obesity. Yes, those are the main factors. And also there are associated factors, recurrent sexually transmitted infections. There are some associated factors. Yes.
You mentioned that breast cancer, there is a correlation between those genes.
Yes.
So you mean that probably if a man is born of a mom or maybe somebody in their lineage who has breast cancer, it raises their chances.
Yes. There's a specific gene called BRCA1 and 2, usually associated with breast cancer and also associated with prostate cancer. Yes.
And what about sexually transmitted diseases? Are there a chance that they're going to raise one's chances of contracting prostate cancer?
It's not proven, just associated factors, just from the statistics, but you can't really point a finger and say like, oh, because this person will be having sexually transmitted infection, they have just an associated factor. Yes, just a risk factor from just the research done, but it's just a risk factor, not a cause. Yes.
Okay, and we have some of other conditions that are affecting this part of the male people that could be confused for prostate cancer. What are some of them, so that somebody who is watching from home, maybe they have another condition and they fear it could be prostate cancer?
Yes, you see, once you look at the presentation of prostate cancer, the way it presents, now there are so many other conditions which will present the same way as prostate cancer. Some of them you can just have hyperplasia, we call it benign. Just benign meaning it is not malignant. Hyperplasia of the prostate. We can have prostatitis, just inflammation of the prostate, can be due to an infection. You can have urinary tract infections, even sexually transmitted. The way they present is the same way prostate cancer will present. Yes, not forgetting prostate cancer can present without any symptoms. Yes.
You can have it and you don't have any symptoms.
Yes.
Now that brings us to the signs and symptoms. Somebody is back at home. What do they need to watch out? What are some of the changes that they could have in their bodies that could that maybe could raise alarm that I could be having prostate cancer?
Okay, we'll start. First thing you need to know can be asymptomatic, no symptoms. You can have prostate cancer and have no symptoms at all. That is the first presentation. So you can have the failure of having symptoms does not rule out prostate cancer. So you can be there, no symptoms, you're living a normal life, but you have prostate cancer. That is one. Number two, when most of the symptoms are usually associated with the lower urinary tract symptoms. So we call it, first you can have frequency, increased frequency. So unakuta mzee kila wakati anaamka anakojoa mara mingi. Okay. Just the increased frequency of micturition, kukojoa mara mingi. Another common symptom is you find someone goes, and once they go to the washroom, once they want to start passing urine, it's so difficult. So unakuta mtu anasimama, they can stay even for almost a minute. There's no urine coming out, but they have the urge. Okay, that is one symptom. And then also finishing. Once they finish passing urine, they have dribbling. So utakuta maybe someone mzee ametoka from the washroom, you find maybe their clothes around this region is always wet. It's not intentional. It's not they're wetting themselves because of the dribbling. Another thing is now the pressure at which the urine comes out. Maybe the urine does not move far, it just drops just below the feet. The pressure is low. Those are some of the common symptoms. Again, for the frequency, if someone usually you sleep at night, you don't wake up to urinate, and then you find now you have to wake up 2 to 3 times at night, you should raise a question. Okay, increased frequency of micturition at night. Another thing is blood. You can have blood in urine. You can have recurrent urinary tract infections. Okay, yes, every time you're being treated for urinary. It's not common for a male to get urinary tract infections, but once you start having recurrent urinary tract infections, you should ask yourself a question. Another thing will be, you said blood in urine. Also, blood can be there in sperms. Okay, you can have blood in sperms. Another factor that would present is can present as a complication. So these people, once they spread of the cancer, they can come with back pain. So you find them, they have urinary symptoms, they're always complaining of the back pain. Usually means this disease could have spread already to the back. You can present with kidney failure, okay, because at times it presses on the pathway, the urethral pathway for the urine, causing kidney failure. So they can just present with all the signs associated with kidney failure. Yes.
And is there a chance that maybe they're going to have painful urination?
It's possible to have painful urination, yes. It's possible to have painful urination, yes.
And you mentioned that mostly...
And difficulty.
Okay. I don't know if it is mostly, but you mentioned something about that you could have prostate cancer, but you don't have any symptoms.
Yes.
So what would you advise our viewers that... what exactly should they do so that they don't have prostate cancer growing in themselves and they're not even aware?
Just the only way to escape this is just screening. It is just screening. There's no other way. There's no other way. Screening. There are 2 modalities of screening. One, you can do a blood test, which is called a PSA, standing for prostate-specific antigen. A blood sample is taken, and then it's tested for the antigen that is produced by the prostate. Another test, which has a low specificity, can miss because it's user dependent, is called a digital rectal examination, where through your anus, through the rectum, the prostate is felt by the doctor. They can identify, they can feel the size and know if there's any alarm. But the most accurate will be doing a prostate-specific antigen. For the age and the frequency of doing this specific test, ideally, just being black is a predisposing factor and being male. So in Kenya, any male above 40 years should have a prostate-specific antigen test done on them. Once you reach 50 years, if you've not one, you are too late already. The frequency of doing it will depend on how the previous test was. If it was normal, 2 to 3 years is enough. Yes.
You're mentioning about taking a measurement of an antigen.
Yes.
So a normal person who is not at risk of maybe developing prostate cancer.
Yes.
What amount or what percentage of this antigen should they have?
Usually the normal value is between 0 and 4 nanograms per milliliter. Yes, that is the normal range. Yes, so by the time you're getting between 4 and 10, there is high suspicion. Okay. If it is above 10, any patient taking a prostate specific antigen above 10, this patient should immediately be sent to the urologist for screening. Above 10, immediately. It's between 4 and 10. Within 6 to 8 weeks, they should come for a repeat. And if it is between 4 and 10, they should have a digital rectal examination done. If there are other factors, further screening should be done. Yes.
And at this screening, is it able to point out the stage of the cancer?
The prostate-specific antigen cannot tell you really the stage of the cancer. It cannot tell you the stage. Yes. And you need other screening tests to identify the stage of the disease. Yes.
And prostate cancer goes through the normal stages of cancer that we've had, maybe with breast cancer, where we hear of stage 1, 2, 3, and 4.
Yes. You can have localized disease, which you can have the disease that is just contained in the gland itself. You can have, as far as most of the areas of spread of the prostate cancer, usually it loves the bones. It loves the bones, usually to the back. So even a person can present with just aches. Okay, it loves the bones, it loves the lungs, it loves the liver and the brain. So those, even a person can just present with confusion. Yes. So the normal spread, yes. Yes, it has different stages. So depending on the time of diagnosis, we'll know at which stage you're diagnosed with, and will dictate the treatment modalities which can be availed for you. Yes.
So is there a chance that prostate cancer is going to affect the fertility of a man?
Not proven, Not proven. Maybe if you can have retro ejaculation, but not proven. Maybe after prostatectomy, but you can live a normal life. Some of these prostate cancers are usually slow growing. You can find some people just leave it, just diagnosed incidentally during a postmortem. You can have a slow growing where you die just of other reasons. So most people live with prostate cancers and they're still having babies everywhere. Yeah.
Although you also mentioned that mostly it catches up with people with age.
Yes.
So maybe they are even past the...
yeah, the other factors coming in, it will kill you faster maybe.
Yeah. So let's talk about treatment.
Yes.
What does treatment involve for prostate cancer?
So for the treatment modalities, it will depend first on the stage at which you are diagnosed with. There are several modalities of treatment. You can have surgery, where you can have maybe a radical prostatectomy, where the whole prostate is just removed, depending on the stage. You can have hormonal therapy. Previously, before hormonal therapy, we used to do what was called male castration, because these cells of the prostate are usually fed by testosterone, which is produced by the testes. So previously, the previous years, we used to do something called orchidectomy, where it's just castration, male castration. But there are so many things associated with that, the ego of the man. So with the current treatment, we have hormonal therapy. We call it androgen deprivation therapy, where we give you drugs which stop these hormones. That is hormonal therapy. We can have radiation therapy, and you can have chemotherapy. Yes.
To us as people who are learning a lot from you,
yes,
we have no idea what is radiotherapy.
Radiation therapy is basically where you have some rays, which are usually directed towards the cancer cell to kill the cells. Yes.
And they're not going to affect other surrounding cells?
The beams, the way the beams are set, they're usually targeted. Yes, and then there's advanced technology, where you have the surgical knife. It's targeting the specific cancer cells. Yes.
And you also mentioned chemo.
Yes. We have also chemotherapy. These are just drugs which also stop the reproduction of these cells and kill these cancer cells. Usually kill the fast replicating cells. Yeah, for this one, they'll kill other cells. Yeah, so you will expect, that's why you find maybe someone goes for chemotherapy, you find maybe their blood levels go low, they lose their hair, because it usually targets fast replicating cells. Yeah, so there are effects associated with, especially chemotherapy, partially radiotherapy. Hormonal therapy has little side effects, maybe just low sexuality, decreased libido, that will be the factors associated with hormonal therapy. For the surgical therapy, maybe what I was telling you, you can have, maybe you find like maybe during ejaculation, you have retrograde. Instead of ejaculating forward, it goes back into the bladder. You can have sometimes urinary incontinence, yes, after surgery. Yes, some patients will require to stay with catheters for long periods of time. So some of the complications associated. But once you weigh, comparing the benefits, versus the associated risk, the benefits most of the time will carry the day. Yes.
And when a patient is going through either of these treatment, is this going to affect their sex life?
During the treatment, depends now with the treatment modality. For surgery, it can lower your libido. It depends. But you have people who have gone through, depends with the size of the prostate during the time of diagnosis. And also chemotherapy, depends with the level. Some people will find they have a normal sex life. Some will have complete loss of libido. It will highly depend on the stage at which you're diagnosed.
And they can get help for that, so they don't get scared for treatment.
Yes.
Okay, that's a lot of insights that you've shared with us here. You mentioned that people were at risk of getting prostate cancer are those people with the prostate gland.
Yes.
And we have transgender people who are they are transgender, so there is a chance they could have a prostate gland. So are they at risk?
So long as you have a prostate gland, you are at risk of developing prostate cancer. If you don't have one, you cannot develop prostate cancer. Takes me back to the diagnosis, something I missed during the diagnosis. Once the prostate-specific antigen is detected to be at an elevated level, it's not diagnostic, it is suggestive. Okay? It is suggestive of prostate cancer. The gold standard for that is a biopsy. Yes. So a biopsy is basically where cells are taken from the prostate, either through the rectum or through the perineum. Tissues of the prostate are taken and taken to the pathologist who examines them to make a diagnosis. Yes.
Okay, thank you so much for all those insights. We are learning quite a lot. Stay tuned for our next segment. Don't go away.
Okay.
GTN TV, the home of gifts and talents, presents you with an opportunity to advertise your businesses, death and funeral announcements, wedding and dowry ceremonies, announcements for government meetings and those of other registered groups or organizations, and many more at affordable prices. For more information, you can visit our offices at GCTC Complex, former Othaya Teachers College, or call us on 0742 606 195 or 0721 706 504 or 0768 411 708. You can also send us an email via sales@gtntv.co.ke. GTN TV, the home of gifts and talents.
welcome back. Thank you so much for staying tuned in. I am right here with Dr. Vincent, who has been educating us more about prostate cancer. And as he mentioned, there is a lot to the male health, especially health affecting the male organ or the male production organ. So there is a lot, and you could get confused. You could wonder, is this prostate cancer or is this any other condition? So before we delve into some of these conditions, you emphasize that a lot of people that maybe are at a higher risk of getting prostate cancer is if someone in their lineage had prostate cancer.
Yes,
And you advise that these are the people who should get screening.
Yes. Yeah, ideally, most of the times you find some people end up maybe dying of prostate cancer undiagnosed, but you can have, now that you know the symptoms, once you have, like, there's history of the family, be it an uncle, be it a grandfather, where there's any history of any person who was associated with prostate cancer, or maybe the female's breast cancer, or even male getting the breast cancer. These are persons by the age of 40 years. They should have the first PSA done by the time they reach 40 years. Because you should have a very high index of suspicion because of the genetics. You said that is an associated factor. It is proven. Yes, it is very important.
And suppose this person comes for the screening the very first time, and maybe it shows that they are safe. How often should someone carry out this screening tests?
For safe means a level below 4. If it's below 4, 2 years is okay, 2 to 3 years. If it's a level which is questionable, between 4 and 10, within 6 to 8 weeks. But the most important, it's not for the patient now, this is actually a message now to the clinicians, the practicing clinicians. Every time you get someone suspected of prostate cancer, or you diagnose a prostate cancer, don't just treat them. Tell them, call your brothers, call if there's the sons, all the cousins, all the males in the family should be screened. Yes, for the clinicians. Yes.
And so while you're talking about this, maybe the male out there who are watching us, they're getting alarmed. What is the situation like in our country right now with prostate cancer?
Prostate cancer currently, it's one of the most commonly diagnosed cancers in the male. The second leading cause of death in male cancers. Yes, it's that worldwide now, worldwide statistics. Yes.
That is scary. So if you're out there watching us, maybe we should get screened right now.
Yeah, we should.
Yeah, so let's talk about some of these other conditions that they might confuse for prostate cancer, like urethritis. What exactly is that?
Urethritis, just as the name urethra, is just the urethra. That's the passage, the passage of the pathway that urine passes from the bladder to the exit of the penis. Is basically inflammation of this. Inflammation can be caused by many things. Can be traumatic, can be infectious cause. Basically, you present with increased frequency of urination. You just find you want to urinate so many times. Maybe when you're passing urine, you find there's a lot of pain, maybe a burning sensation. Yes, at times you can have blood in the urine. Those are the common things. Or difficulty trying to pass urine. It's so difficult. Yeah, especially one of the most common causes usually gonococcal urethritis, caused by Neisseria. It's very painful. Now it's not very common to get gonorrhea, but one of the most common. You will know, you just hear someone going to the well, and you just scream. Yes, yeah. So, that is urethritis.
And then we also have prostatitis.
Prostatitis, prostatitis is just inflammation of the prostate. As earlier we had mentioned, apart from when you have inflammation or enlargement of the prostate, it doesn't necessarily have to be malignant. Yeah, we have benign prostatic hyperplasia, just where the cells just grow, they increase in size. This prostate increases in size as you age. Yeah, so that is very normal. It's expected to increase in size as you age. Usually the size of just like a walnut. That's the size of the prostate gland. So you can have an infection, just like any other part of the body. You can have an infection of the prostate. Yeah. So that is what we call a prostatitis. You can have maybe had a sexually transmitted infection where the infection now has spread up to the prostate. Yes.
And so that is what we call that. And then you said it's rare for men to get urinary tract infection.
Yes,
Does that happen?
Yes, it does happen. Yes.
And what is gonna cause this for men? You know, for women, we know that it's because they have a relatively shorter urinary tract, but what exactly happens with the male? Yeah, because the urethra of the female is about 4 centimeters. For the male, can be up to 20 centimeters. And the lining of the urethra is usually covered by something called an epithelium, which creates a barrier for infections going in. So if you look at the length of 20 centimeters, it's so difficult. Urinary tract infection is usually two-way. You can either ascending from down, coming up, or descending from the body system, going down. That's maybe from the kidneys. Okay. Yeah. So you can get maybe a systemic infection infecting the kidney, now infecting your urinary tract system, or maybe now from down outside now going up. So for the ascending infection for the male is very difficult because of the length of the urethra. By the time the infection is ascending upwards, most of the time it's just cleared by the urine. But now, if there is obstruction, there is stasis, there is inflammation, anything that is obstructing the flow of urine, now there are higher chances of getting the urinary tract infections in the male. Yes. So I don't know if it's a condition, but we have male with an overactive bladder.
Yes, overactive. You can have overactive bladder. This is a condition which will present similar to prostate cancer. It's just basically where person they just want to go to the washroom to urinate after every few, maybe 30, 40 minutes. Yeah, once there's little urine in the bladder, they want to. Yeah, but there is medication for that. Once a patient comes for us with that, once we diagnose an overactive bladder, there is medication to help with that. Yes.
So for anyone who maybe they suspect they have any of these conditions, they could get help. Then there is epididymitis.
Epididymitis. Yeah, this is just the epididymis is where the sperms are usually stored after being produced from the testicles. You can have infections infecting the same area. You can have even sometimes you have something we call otitis. Otitis is basically infection now affecting the testis itself. Epididymitis is now the epididymis where the sperms are stored. You can have a sexually transmitted infection. That's the most common cause. They usually find it spread to that area. Yes.
Now, is there a chance that these conditions that we've just talked about and highlighted, is there a chance that they could prompt prostate cancer?
Not documented. Research is still ongoing. They're just speculations, but not documented. Yes.
So while we were talking about treatment for prostate cancer, you mentioned 4 different types of treatment. Now, could you share with us in this segment what is going to determine what kind of treatment that a patient is going to undergo? Why would this patient get hormonal therapy? Why would this one get radiotherapy? Why would this other one get chemotherapy?
So as I said earlier on, this will go back to diagnosis. So once you come, maybe you have your symptoms, you have symptoms suggestive of prostate cancer. We do a PSA level for you suggestive. The next step will be to do a core biopsy. A biopsy of the prostate is taken. An MRI can be used also to diagnose, and you can also have a PET scan done. An MRI is just a magnetic resonance imaging. Is a highly detailed of the pelvic, can visualize the prostate properly. A PET scan is a full scan of the whole body, highly detailed. So once you get the specific stage where the disease is at, that's when we determine what is the next modality. If it is localized the disease in the prostate, the first treatment is radiation therapy. For this particular patient, radiation therapy is the treatment modality of choice. If it's advanced disease, always we have combination of hormonal therapy. All patients will be put on. Remember we said these cells are fed by testosterone. So first you want to stop feeding these cancer cells. Okay. we are not doing some, maybe in some setups where maybe the patient is not able to afford it. I know the hormonal therapy, some are a bit pricey. If someone is completely not able to afford, that's when you can do surgical, the male castration. But if you're able to use the androgen deprivation therapy, you just give the medication, they stop the hormones which are feeding the cancer cells. So hormonal therapy will go a long way for all the patients. Now, going to chemotherapy, this is now a discussion which will be held between now the patient and the oncologist. Now, depending on the side effects, they sit with the oncologist, they discuss the way the risks versus the benefits. Yeah, but most patients do well with surgical therapy and hormonal therapy. Yeah, some usually require chemotherapy, but that is a discussion where it's individualized for every particular patient. But for early disease, it's radiation therapy, immediate radiation therapy.
Yeah, you're mentioning that most patients, when it comes to chemotherapy, they're going to have to sit down with the doctor and agree and weigh the side effects and the benefits.
Yes.
Is it that chemo has a lot of side effects? What are these side effects that you're talking about? Okay,
as you said, for chemotherapy, it usually kills the fast replicating cells of the body. Okay. So one, you find your blood levels will go down. Some people usually even get the effect of maybe the hair loss. And once you weigh, you see most of these cancers, the cancer also will dictate the type of treatment. Some of these prostate cancers are usually slow growing. Yeah, that's why I said some men will get prostate cancer, just die with prostate cancer without getting a diagnosis if it's a slow growing. So depending on the specific cancer type you have, that's when now we have the discussion. You need chemotherapy or you will survive without chemotherapy. Yes.
Okay. Is there a chance that prostate cancer can spread to other parts of the body, like the way we have this happening with maybe people with breast cancer, that if left unattended or if you realize at a later stage, it could have spread to other parts of the body?
Yes, like any other cancer, it can spread. The most common area of spread of prostate cancer is to the back. Usually it loves the bones. The closest bone is the back. So you can find even a patient just coming, maybe just low limb weakness. Maybe it has affected the bones of the spinal cord, where they cause even cord compression. Once the spinal cord is compressed, you get paralysis happening. It can spread to any bone. It loves the bones, any bone of the body. The lungs, it loves the lungs, and also the brain. So the brain and the liver, those are the most common areas of spread of the prostate cancer. Yes.
And this could start happening at what stage of the cancer?
By the time you are getting spread to these areas, you're already in stage 4. Yes.
So the moment it spreads, that just means you are in stage 4.
You're already in stage 4, yes. Yeah.
So is there a way that we could prevent prostate cancer? And even before we talk about how to prevent this, you mentioned about obesity as a risk factor for prostate cancer. And we are in the central region of Kenya, and a lot of people are...
Waru mingi.
Yeah, tumekula waru sana, and a lot of people are... How exactly is obesity contributing into this, so that someone can understand the danger they're getting into by the time they're not managing their weight?
For obesity, not only for prostate cancer. Okay, today we're talking about prostate cancer. But once you live a sedentary lifestyle, where you have limited activity, you predispose yourself not only to prostate cancer, you have cardiac diseases, you have diabetes. The way your bodies are built, you just have to maintain your body mass index within the required limits. So generally, we have to live in moderation. If it's maybe like a glass of wine, just have within the limitation. If it's smoking now, that one it's just complete cessation. Some of these lifestyle modifications, it's just a choice. It's a choice that you make, which I would advise. Every choice has a consequence. Yeah, but for obesity, it's a risk factor for prostate cancer and many other cancers. You remind me of when I was in school during examinations. Maybe when you're given a question, maybe risk factors for any disease, maybe cancer. If you don't have points, you just write obesity, smoking, alcohol, excessive alcohol drinking. So once you have those things, you're at risk of so many diseases. So many diseases. Yes.
Now, you see, Dr. We have been told over and over again, and like you're saying that any other disease out there, most of them, when you're asked what is the risk factor, what is going to maybe raise your chances of contracting this disease, obesity is most probably going to be there.
Yes.
But I don't think the layman person out there really understands why is obesity such a big deal in anything in terms of health. Why is it such a, exactly, like, could you break down to us why obesity is so dangerous for anyone?
Okay, for once there's lack of activity, obesity will come with lack of activity. You have a lot of fat deposition. You have immune regulations. There are so many factors, immune cells, which are usually affected. The immunology, there's a lot of cells which become resistant to some of these immune cells.
Coming in as a factor for most diseases. Why is it so dangerous to be obese?
Obesity just comes with lack of activity. Once you have lack of activity, you have a lot of deposition of adipose cells, which will affect your immune regulation. Usually it's just immunological related. It's something where we say it's by studies. You see, once these studies are done, they usually done, you do a study with obese versus not obese, then you get the statistics. You find always when someone is obese, they are inclined to most of these conditions because of the adipose and the immune regulation. Yes, basically the immune system regulation is affected. Yes.
Yeah, so dear viewer, we have to maintain a healthy weight if we are going to stay away from prostate cancer and a lot of other diseases. Yes, what else should we do to prevent prostate cancer?
For prevention, once you do your normal lifestyle, you live what you said, maintain a good weight, a good body mass index, you drink your alcohol in moderation. As we had said earlier, very important, just the screening. Because most of the times, most of the patients, like 70%, the diagnosis is made incidentally. So the only way you can know is by screening. Early screening. Actually, this reminds me of a case of one patient I saw like 3 years ago. It was a 42-year-old male. They presented with renal failure. He had all the signs of renal failure. He just came with vomiting. We did the tests. The creatinine is urea. The renal functions were markedly deranged. The patient we started on dialysis. You know, at 42, the index of suspicion of prostate was very low. And then one physician whom we had him down said, let's do a prostate-specific antigen for this particular patient. We did a PSA for this particular patient. It was above 400. This patient, we sent them, we told them they need to do a biopsy of the prostate. The patient was reluctant. I remember we discharged them. They went home, they skipped dialysis sessions. After they felt well, after the initial dialysis sessions, they just went and lived their life. They came back 2 months later, again, in renal failure. Yes, this patient, but we said, you do a prostate-specific, you do a biopsy of the prostate. That's the time they agreed. By the time we did the biopsy, before the results came, the patient had already left us. Yeah, may it's called rest in peace. But it was so unfortunate. At 42, can you imagine? Yes, it was already metastatic disease. Yeah, it was already spread. It was causing urinary obstruction. It had blocked the pathway. The kidneys were really dilated. Yeah, it was a very sad story.
So this means that...
So screening is of utmost importance. Yeah, so once, if you're a male, you've been 40 years, get that PSA done. Yeah.
Is there a kind of a diet that is going to raise one's chances of getting prostate cancer?
Not documented. Not documented. Yes.
But people should just eat healthy.
Yes.
And any other factors, maybe exercise?
Exercise is important. Exercise is important. Just to maintain a good BMI, exercise is routine. You have to maintain, you have to keep fit, yes.
So there is, I don't know if it's a myth or exactly what it is, but people say that once you are diagnosed with prostate cancer, you should rush to have kids, you mentioned that it's not documented that it's going to affect, but would you advise the same?
See, the location of the prostate does not affect, not unless you have a very large prostate, where now it is even blocking now the flow of the sperms, the spermatozoa and the semen. But most of the times, by the time you're being diagnosed with prostate cancer, you're already in your 5th decade of life. Yeah, so I wouldn't see much of a rush, because once you start the treatment modalities, you can still be able to science. Yes.
And what are the chances that a child you sire while you are still treating prostate cancer, or you have prostate cancer? What are the chances that you're going to transfer it to this child?
No, the risk remains the same, because you have, if they are of the male gender, they'll still have a risk. Not because you are diagnosed with prostate cancer when you are saying that, but just because they are of the male gender and in the same lineage. So there are chances they could have the genes which are associated with prostate cancer. Yes. Not specifically because at that particular time you are diagnosed.
Okay.
Yes.
And you also mentioned that a male who comes from a lineage where maybe a mom, an auntie, or a grandmom maybe suffered from breast cancer, or even a male suffered from breast cancer, because breast cancer can be in both genders. So is there a chance that a daughter or somebody in the lineage of a male who had prostate cancer, is there a chance they're going to have other cancers that affect women, especially breast cancer?
For usually, there's something we call genetic testing. Once you identify these cancers, maybe that's what I was saying, there are genes which are similar. There's a gene which is associated with breast cancer and prostate cancer. Yeah, that specific gene, once you have a close relative, that's when you have the screening done. So it's not a must to have this particular gene, but most of the time it is associated. It's not a must to be there, but most of the time it will be there. Yes. So long as there is that, it's good to get the screening done. Yes.
So as we near the, as we are almost winding up, for most of these diseases, any other diseases there, it is collective responsibility for us to fight with these diseases. What is your call to all male, and also to the professionals, and also to the government when you're dealing with prostate cancer? Do you feel like it has been sensitized enough?
For the sensitization, it has been done, but not enough. My message to most males, I know it's very difficult. I think it's just maybe because of the ego. Most men will suffer in silence, because most of the patients I usually see, you find maybe it is the wife that will say, will give the symptoms. Will say, I'm there at night, anaamka mara mingi anakojoa. It's the wife that will present the symptoms. I'll encourage them to keep doing the same, because now we know. So if kama unaona mzee anaamka usiku mara mingi kojoa, it's time ulize, daddy uko sawa? If every time you see the trouser is wet or they're smelling urine, it's a sign, it's an alarm sign. Okay, those are the times to intervene. For the clinicians, it will be very unfair for you to meet any male of 50 years and go without doing a PSA for them. It will be so unfair if you don't inform them they need to do a PSA, and doing a PSA for them, you'll have done them injustice. For the government, I think it's just facilitating to support the health care services in subsidizing, and also in just passing this message to the community, just more broadcasting of the message and facilitating and subsidizing the tests of screening. Because the initial tests for screening, they're a bit expensive, because you see, once you do your PSA, to do your biopsy, maybe by the time you're doing your PSA, your biopsy, your MRI, most of the time this particular patient will spend 30,000 or more. Yeah, we hope with the universal health coverage, this will be able to be catered for, because very few patients are able to afford. Yes.
And that is also leading the patient down the drain, even if they came early. Yes. So someone is asking, is there a difference between surgery to treat prostate cancer and vasectomy, is it kind of the same, only that vasectomy is done willingly so that you don't sire further children?
The two are completely different. Completely different. For surgery of the prostate, this is usually done for maybe patients who maybe are not able to get radiotherapy and disease is confined in the prostate, or maybe they're doing for maybe to open the pathway for passage of urine, which we call it prostatectomy. Once that is removal of the prostate gland, can be done in whole or partial. For vasectomy, this is just where the passage from the testicles, they are the vesicles which transport the sperms. Okay, that is where the ligation is done. Yes.
So they're totally different.
Completely different.
Okay, that is interesting. I hope they have learned. And we've talked about treatment of prostate cancer. But can it get totally cured with treatment?
In the early stages, yes, it can be totally cured. If you have a disease that is confined by stage 1, it can be completely cured. Yes, it can be completely cured. If detected early, you can get complete cure. But once it's advanced stage 4, it's difficult to get complete cure. Yes.
And what is the life expectancy of someone who is living with prostate cancer?
Will depend on the type of cancer itself. We have slow-growing cancer, as I said, where a person will live with prostate cancer, die of other reasons. We have a fast-growing, where if you get someone, you find if it's advanced, the 5 years, however, less than 30%. Yes, when they're in stage 4, it's only 30% will reach 5 years. Yes.
So, at what stage are most male people, especially in our country, getting diagnosed with prostate cancer, especially because you mentioned that it is going to be asymptomatic? You could have it, but you have no signs, and symptoms, and so you don't know. So in our country, exactly at what stage are people coming to the hospital?
It's so unfortunate, but I will say maybe 80% of the patients I've diagnosed are in stage 4. Yeah, 80% from experience. About 80% are in stage 4. Yeah, because they come with the complications. They come, maybe they can't walk. They come maybe with a lot of confusion. Mostly it's back pain. Most of them present with back pain. Yeah, you ask them about their symptoms, and they started like 3-4 years ago. But they just come because of, you see, for men, as I said, they will stay, they will die silently. Yes, that is the problem we have. Yeah, but recently, with the new screening, we are diagnosing stage 1. Yeah, several. Yeah, last year we had 3. Yes, and we sent them for radiation therapy. Yes,
that
and they're
came at stage 1.
Yes.
So that is quite unfortunate, and we need to sensitize our men more that they need to stop being so afraid of the hospitals. The doctor is only going to help you. So mostly you're saying that they'll not come to the hospital because of ego, and is it going to affect their mental health once they get diagnosed with it, given that most men want to stay strong even when it's not time to be strong, There are times when you don't have to be strong. You just have to go to the clinician and get the help you need. But most men want to be strong all along. So once they're diagnosed, is it going to affect their mental health?
Not really. Once you do the approach well, once you do the diagnosis, because once you do the diagnosis, it comes with counseling. How you break the news is very important. Yeah, I know there's a saying, whatever you don't know doesn't kill you. I disagree. I beg to disagree with the saying. Because initially, most men thought of the screening of prostate cancer will entirely involve a digital rectal examination. That's usually the most difficult part in most males. Usually they are scared of. But the good news is now with just a blood test, you're able to screen. Yeah, because most of the time, we used to do the digital rectal examination first before going for the PSA. But now with the availability of the tests, yeah, so it is so easy. Just get a simple blood test and you can move forward. Yeah.
So what I'm getting from Dr. Vincent is that if your prostate cancer can get diagnosed at stage 1, chances are you're going to live on. And
Completely.
yeah, so this is a special appeal to the male to get screening.
Yes.
You will do that using that camera as we wind up. Yeah, and if you wanna shout out to anyone using that camera as your video viewers go by.
So wanaume wote, kama umefikisha miaka 50, make sure umeenda hospitali umefanyiwa kipimo ya prostate. Kwa Kiswahili inaitwa tezi dume. Tezi dume. Make sure you get that prostate test if you're above 50 years. If there's any person in the family ushaisikia kuna shida ya prostate, at 40 years, make sure you get the screening done. Yes. That is my message. Yes.
Anyone you want to shout out to?
My family. Nawapenda sana. My dad, my mom, my wife, my kids, and my brother and sister. Yes.
Thank you so much. It was a pleasure having you here. We have learned a lot, and yeah, that is your take home right there. If you are a male, if you have a prostate gland, and you are over 40, you should be getting frequent screens of prostate cancer, and everything is going to be fine, especially if you get diagnosed at stage 1. That means that you can get cured and lead your normal life. So thank you so much for tuning in to Medi-Camp. I have been your host, Mumbi Mavuti, and every other day we remind you that your health is your wealth. See you in our next episode.
Kwĩgwatĩra Musa kũrĩra kwa Jithero Ro Andy Wawa featuring Elizabeth Nyambere. Tasikiza tuni ya thimũ yaku, hihinya *837 *3260# ũkenagie harĩ marakũrĩra thimũ na rũgambi rũrũ.
Sharia hado ũngĩthomera gũkunya gita, piano kana mĩgambo nĩyo vocals. Rehoboth School of Music maheanaga mathomo ma kĩrathi kĩa igũrũ mũno. Macerere Nyeri Town harĩa opposite Naivas Supermarket, kana waranĩrie nao kũhetũkĩra namba cio cia thimũ 0715 031 506. Rehoboth School of Music, cama wa rwĩmbo nĩ inanda.
Jerusha.
Waigirira ku.
Ngokea kuingia huko na ni kwa my sister.
Mukanuta njira rendo ume uthii ndina wira muingi muno ni.
Giki uragurire ku.
We ni guthaka urathaka.
Ite icio harutire ku cia migio na njeki.
Atiriri gite giki ni ndike importete kuma murimo we.
Ndini no ngutwe handu ngava na guraga ite. Haiya, tanto thione. Tuthie. Ogetikia kiugo giakwa.
Ndathi ndona ni urimo ni ugwitikia.
Ti urimo. Tanto thione ite icio. Ni tuthie. Wone ite kwagira.
Tuthie. Ndugitire ko guca ndukanude.
Lola kamera.
Atiriri ginya kamera gathaka gatha.
Urauga atia? Lola giti. Giki Kiriaini. Giti kiega. Giki nikio gitagwo kangaroo. Giti kiega.
Ni uko ni kwa makia.
Wira
ndiragura ciothe ici ciothe
na reke nguthitũre nĩ transport ũheagwo bure gũkũ transport nĩ bure
na gite kunjira ni kindetu wewe
ti nyamũ icio hathire kũgĩra cia mĩgio na nyeki
ikamenya ni kiriku na kiriku ndirathura
ndugetikire gicono ta giki Generation Furniture Mart ni njuru cia wendi wa furniture star kabati metha dining table itanda gatakati kaingi ni gukugatira uge muta uyu gwaku tuce nduka-ini itu muno wa scooter account ya Nyeri kana uhure thimu namba 0721 174 477 na ni tuka delivery Generation Furniture Mart where quality meets comfort.
Completeness and perfection are great words to describe our journey on